Today we are going to talk about the intracellular accumulations. The intracellular accumulation mainly divided into accumulation of substances and that gives specific color to the organ where it accumulate. They are called as the pigments, and accumulation of protein, carbohydrate and lipids, and accumulation of calcium inside. So that is also called as calcification, including the metastatic calcification, and we will also talk about the dystrophic calcification. So what is the reason behind the intracellular accumulation? The main reason behind the intracellular accumulation is that whenever there will be a defect in the mechanism or the enzyme that are responsible for the metabolism of these substances, like for example if we take only protein, then protein need to metabolize and it need to make certain other components of a cell. Carbohydrates, they are metabolized and they give energy to the cell, to the tissues, to the body. Whenever the enzyme that is responsible for the metabolism of protein, carbohydrates, lipids and homocysteine and other compounds, they get disturbed or their function become affected, then these compounds, these protein, carbohydrate, lipids, they start to accumulate into the cell. Like in this particular image we can see that in the cell there is accumulation, and this accumulation is the glycogen accumulation, and glycogen is a carbohydrate, and this one is due to the defect of glucose 6 phosphatase enzyme defect. So once G6P deficiency will be there or mutation will be there, then it fails to metabolize the glycogen, and then the glycogen start to build up into the cell, and that leads to different manifestations. So we will talk about one by one that are stored or accumulate into the cell. The first one is the accumulation of protein into the epithelium of the proximal convoluted tubules. So we can see, now we'll try to find that what this histological image is showing. So we can see that this is what the tubular network. So these are the proximal tubular network, and these are the epithelial cells. So the epithelial cells, they are loaded with some pinkish substance. So this is what the lumen, and this is the lumen also, and these are the nuclei, the blue or all the nuclei. And there are in the cytoplasm is always stains, pink on H&E staining, but here there are enough proteinaceous substance into the lumen as well as into the cytoplasm. It's mean that protein, they are accumulating into the epithelial cell. There is a syndrome called a nephrotic syndrome where a lot of protein, they leak out into the urine, and these cells start to reabsorb a lot of protein. So these proteins then start to accumulate into the cell. So what is the stain that you use here? The stain is H&E staining. Accumulation is protein accumulation. Color pink. The organ is kidney because the tubular network is given here. Now what they are asking further? They are asking to show the protein location, to show the normal tubule, and to show the tubule with protein. Now let's go back to the image. See, where is the protein? So these are the protein inside. This is also the protein, but into the lumen. These are the proteins inside the cell. Where are the cells which are normal, or we can say there is not enough protein inside? So we can take a sample of this cell, this epithelial cell. They don't have much accumulation of protein. Now go for the next image. This one is a very important for your exams. So what this image is showing? This image is showing the hepatocytes, the liver cells. So all these are the liver cells. But some liver cells, they have some sort of pinkish deposition inside other than the cytoplasmic substance. So now, if they have given a history of alcoholic patient and he died, and after autopsy we got the microscopic sample, and upon examination we found such things. So this cell and this cell is also a hepatocyte. This one is a nucleus. This one is also a nucleus. And what is this white thing inside? This is nothing. It's a lipid. So this image is showing accumulation of lipid inside. Two cells showing lipid accumulation. And these cells, they are showing some accumulation of highly eosinophilic or highly pinkish substance inside the cell. So what are these highly pinkish substances? They are nothing but the proteins. So these proteins, when they start accumulating into the hepatocytes and the patient is alcoholic, then these eosinophilic bodies are called as the Malaria bodies or Malaria Hyaline bodies or Malaria dung bodies. So Malaria Hyaline bodies, Malaria dung bodies, they are nothing but they are the protein accumulation. Now let's see what they are asking and what is in the description. It's a protein accumulation in the hepatocyte called as the Malaria bodies associated with alcoholic patient. Stain H and E staining. Accumulation is protein. Color highly eosinophilic or highly pink. The organ is liver because these are the hepatocytes. Now they are asking find the protein that is the Malaria bodies. So these are the Malaria bodies. Find the hepatocytes and the nucleus. So this one is the hepatocyte. This one is also a hepatocyte. And these are the nuclei. And the normal cell. Normal cell here in this image. This one is a normal cell. There is no accumulation, no lipid accumulation, as well as no protein accumulation. So this was about the Malaria dung bodies or protein accumulation. The next one is a normal image of blood vessels. So here we can see this is the lumen and this one is the vein and this one is the artery. So why this one is artery, this one is vein? Because vein usually cannot maintain its architecture because of the muscles around or near the vein. They compresses the vein and the vein has thin layer of smooth muscle and the pressure inside the vein is less. That's why the architecture is not completely circular. While if you compare this one, if you see this one, a thick layer of smooth muscle and high pressure inside. That's why arteries, they are circular and keep their architecture. Now let's see the components. This one is the endothelial lining of the artery. Between this layer and the endothelial cell, this gap is the tunica intima, and the outer layer to the intima is the internal elastic membrane. After the internal elastic membrane starts a smooth muscle layer. Then the smooth muscle is bounded by another layer, that is the external elastic membrane. After the external elastic membrane, there is a tunica adventitia. So tunica intima tunica media and tunica adventitia. Inside the tunica adventitia, we have small vessels that provides blood supply to the vessel itself, and these vessels are called as the vasa vasorum. And the neurons that we can find in the adventitia, they are called as nervi vasorum. Here the same. This is for the middle layer, tunica media, and a tunica adventitia. And in the proximities, we can find some small tributaries of vein. These are the smaller veins. There is lymphatics, which follow the vein. And these are the fat tissues. Now I hope you understood the structure of vein and arteries. If you understood that one, now let's see here. And we will try to find the vein, arteries, and the lumen. Now, if we look in this image, we can find a different lot of cells in the interstitium, a vessel, a tubular network lined by epithelial lining, columnar epithelial. These are the epithelial cells. This is the lumen of the tubule. So this is the renal tubule. And this one is the vessel. So we can see that in the vessel there is accumulation of pinkish substance. So these are the accumulation of proteins, and that is called hyalinosis of blood vessels. So what description is saying? The description is protein accumulation in the vessel lumen is called as hyalinosis. In some diseases, when there will be benign hypertension, then in the vessel we can find a lot of proteinaceous substances into the lumen, into the vessel wall, along with the cells. Okay, so that is called as hyaline arteriolosclerosis. And this hyaline arteriolosclerosis is also protein accumulation, as we can see here. There is accumulation of a lot of protein into the vessel valve. So this is also called as hyalinosis. The stain used is hematoxylin and eosin. Accumulation is protein. Color is pink. And which organ is this? If you know that these are the renal tubule, then it should be the kidneys. And these are the vessel of the kidneys. So they are asking, show the protein. So we can see this is the protein accumulation. The vessel lumen. This one is the vessel lumen. Show the renal tubule. This one is the renal tubule. Cells. All these are the cells. So these are the cells. And the nucleus. All these dark color things, there's a nucleus. Now let's go for the second image. This is again the protein accumulation. The next one is very important, and this image is associated with diabetic nephropathy. Previously we said that there is accumulation of protein into the vessel wall, into the vessel lumen, into the vessel layers, different layers. But in this condition, if you know the structure of the nephron, then you should understand that the nephron consists of Bowman's capsule and glomeruli. The glomerulus, if you know the structure, it's somewhat like this. The efferent and the efferent vessels. There are a lot of interstitial cells along with the endothelial cells. And the endothelial cell, if I make like this one, so this one the endothelial cell, then there is a basement membrane, then there are the podocytes. So this one, in this image we can see here, this one is the glomerulus, this one is the Bowman's capsule containing fluid, and this is the mesenterium along with the cells of endothelium, podocytes, and the basement membrane. So what we are trying to find in this image, we are trying to find some abnormality, some accumulation. So in this image, the Bowman's capsule is okay. The parietal cell of the Bowman's capsule also okay. These are the squamous, epithelial, parietal layer. Just here the podocytes, okay, no problem with that. This is the blood vessel with RBC inside, okay, no problem. But in this area and in this area, there are highly, or we can say, eosinophilic material deposition. So in patient with diabetic nephropathy, the efferent and the efferent artery also get affected. Once the efferent one is affected, then there will be hyalinosis of the vessels. Previously we said that once there will be accumulation of protein in the lumen, into the vessel wall, the lumen become narrowed. And this is, I said, what is this condition called? This condition is called Hyaline Arteriolosclerosis, the protein deposition into the layer. And this one is specific for diabetes mellitus patient. So patient suffering from diabetes mellitus, we can find such vascular problems. So here, once the lumen become narrowed, it exerts backward pressure. This pressure causes leakage of protein and proliferation of the mesenterium. This leakage of protein causes accumulation of protein into the mesenterium, as we can see here. So this localized only a specific area, not whole, only this area. Only a localized area is affected. So this is called as protein accumulation, and if it is associated with diabetes mellitus, and if it is associated with a localized area, then it is called as the Kemmel-Steele-Welson nodules. So what they are called? They are called as the Kemmel-Steele-Welson nodules. So Kemmel-Steele-Welson nodules are nothing, they are the protein accumulation into the glomerulus. Now what they are saying, these are the protein accumulations into the glomerulus. Seen in the diabetic patients, stain is hematoxylin and eosin, accumulation is protein, color is pink, organ is kidneys, because glomerulus is found only and only in the kidneys. So they are asking to show the protein location. This one is the protein location. Glomerulus, this one is the glomerulus. Renal tubule, here is the renal tubule, here is the renal tubule, and here is the renal tubule, here is the renal tubule. And cell, so all these are the cells, all the nuclei, they are the cells. All these are the cells. Nucleus, the blue are the nucleus. Cytoplasm, the pink area around the nucleus is cytoplasm. I hope you understood this thing. Let's go for the third image. Okay, so this image is again a protein accumulation, and this is a very, very, very important and very high yield. So in case of multiple myeloma, what is multiple myeloma? It's a disorder of plasma cells. So plasma cell proliferations leads to formation of a lot of immunoglobulins, and then these immunoglobulins start to accumulate inside the plasma cell. So this is the plasma cell, so these are the immunoglobulins start to accumulate, and immunoglobulins, they are the proteins. So it's again a type of protein accumulation. If you see this plasma cell, we can find this one is the plasma cell and this one is the nucleus, and inside the nucleus there is a accumulation of protein. That is called as the Dutcher bodies. Dutcher bodies are immunoglobulin or protein accumulation inside the nucleus. So these are the intranuclear immunoglobulin depositions. That is called as the Dutcher bodies. Now next one is a very beautiful image. It's a mode cell. So mode cell or Russell bodies. The Russell bodies are these accumulation of immunoglobulin into the cytoplasm, not into the nucleus. So these are the cytoplasmic accumulation of proteins or immunoglobulins. So mode cell and Dutcher bodies is seen in multiple myeloma. This is the protein depositions. Next one is a fatty liver. This is the liver, and we can see that the surface is smooth and is yellowish. So it's a fatty change in the liver, like accumulation of lipids into the liver. So fatty change of the liver because of accumulation of lipids. The organ is liver. Accumulation is a lipid. Size, because of accumulation of lipid, size of the liver increases. Surface become smooth. Consistency soft. Margins perfect, clear, and the color will be yellowish. And the cut surface we can show yellowish deposition of lipids. Causes alcoholism. This one is the histological image of the liver that's shown above in above image. So this is what all these white droplets, they are the lipid accumulation. If you try to magnify this image, let me magnify for you. So if you try to magnify, you can see that these are the, see the white thing, they are the fat droplets, and they are pushing the nucleus toward the periphery. Now let's define if I zoom this image, if I try to make it like this, you can find a nuclei on the periphery, and this one is a big droplet of fat. So this is again the fatty change of a liver histologically. So fat that deposits inside the cell and pushes the nuclei toward the periphery. So all these are nothing but the fatty change. And this one is the fibrotic area. So what they're saying, it's a lipid accumulation in the hepatocytes that is seen in the fatty change liver. The stain is hematoxylin and eosin. Accumulation is lipid. Color is white because it doesn't stain. Organ is liver because these are the hepatocytes. They're asking find a drop location. I said these are the all these white they are the fatty accumulations. They're also called as steatosis, hepatic steatosis. Hepatocyte with lipids, again the same. These are the hepatocytes with lipid accumulation. Nucleus location is on the periphery. If you zoom this image and see and try to figure out, then you can find that the nucleus is pushed toward the periphery because of the drop. Next one is the glycogen deposition. The glycogen deposition is seen in glycogen storage diseases. One of the diseases is MC Arnold syndrome or MC Arnold disease, where is a genetic mutation of glucose 6 phosphatase. Because of that, glycogen doesn't convert to glucose, so there will be muscle wasting, weakness, and failure to thrive, especially in the child. So all these are the skeletal muscles, and this is the sarcolemma. They are separating the bundle of muscle fibers. But just near the sarcolemma, we can see these are the droplets, or these are the accumulation of glycogen. So glycogen deposition in the skeletal muscles. What they are saying, these are the carbohydrate accumulation in the muscle. Glycogen is a carbohydrate seen in glycogen storage diseases. The staining is hematoxylin and eosin. Color is pale or slightly pinkish, but usually pale. Pink on pass staining. This one is not a pass staining. If we use a pass staining, we can find pink depositions. On H&E, it's pale. Accumulation is carbohydrate and glycogen. Glycogen is a carbohydrate. Organ is muscle. Now they're asking location. Location, I said these are the subsarcolemmal depositions. Sarcolemma, these fibrotic band, covering the skeletal muscle. Muscle bundle, these are the muscle bundle. And nucleus, like bluish things, they're all the nucleus. In this image also, they're showing that these are the glycogen accumulation. The next one is again the same, but the staining is different. This is again the carbohydrate accumulation in the muscles, glycogen storage diseases. The staining is Gomori trichrome stain, shows a blue color, bluish accumulation. Accumulation is carbohydrate, organ is skeletal muscle, glycogen location, and the nucleus. So we use three stains, H&E staining, Gomori trichrome staining, and what we say pass staining. So these three stainings we use for the glycogen accumulation. The next one is atherosclerosis, is again example of the lipid deposition. So if you compare these two images, we can see that the cross section image of the lumen of this one is completely clear. This is the inner side of the aorta, normal aorta, while this one is not a normal, this one is the abnormal one. Why? Because we can see a lot of yellowish depositions. So whenever there is a deposition of lipid into the tunica intima of the aorta, that can cause narrowing of the lumen along with the loss of elasticity of the vessel. And this condition is called as the atherosclerosis. So atherosclerosis is nothing, it's accumulation of lipids or fat into the tunica intima of the vessels. So what they're saying, it's a lipid accumulation in the aortic valve seen in atherosclerosis. There is no staining use. The accumulation is lipid, organ is aorta. Find the normal and the disease one. This one is the normal one. This one is the disease one. What are the black dots in the given image A? So what are these? So these black dots are the lumen of vasa vasorum. And vasa vasorum, what is this? These are the vessels. They are responsible to provide blood vessel to the different layer of the wall, different layer of the vessel itself. The next image, it will be again the same. So here we can see different stages of atherosclerosis. Number first, number second, and number third. Number first, these are the small depositions. It may be normally seen in young adults. So the initial stage of fat accumulation is the fatty change. Gradually it progresses, and it leads to accumulation of more and more fat into the tunica intima, and that leads to accumulation, and that leads to the formation of the fatty plaque. So here we can see different fatty plaque accumulation, and gradually once it become into the severe level or the complicated stage, then there will be erosion of the vessel wall, there will be damage to the different layer of the vessels, that can lead to dilatation, abnormal dilatation of the vessel wall called as the aneurysm. It can also lead to ulceration, and sometimes it can cause a rupture, or in small vessel it can cause completely occlusion of the blood vessels. This one is the same image. We can see this is the ulceration, and these are the fat depositions. Here is the same one. We can see this is the lumen, tunica adventitia, tunica media, tunica intima. So in the tunica intima there is accumulation of lipid, and this is the lipid rich necrotic core, because inflammation also happening here, because lipids, they accumulate, they oxidize, and it attract macrophages. These macrophages cause damaging engulfing of the lipid along with the release of different sort of cytokines, and that initiate a inflammatory response. That is the necrotic area. So that's why they are saying that it's a lipid rich necrotic core. Now they're saying tunica intima, this is normal, media here is normal, adventitia here is normal. So this one is a normal, here is also the normal one, and here is the affected area. In this image also there is accumulation of fat or the lipids along with a necrotic core and a fibrous cape which is covering the lipid. So it's somewhat like this one. So this is the necrotic core, fatty deposits along with the covering, that is the fibrotic. So it's a thin fibrous cape, and this is the atherosclerosis. Here again we can see this one is the lumen. The lumen is narrowed because of the necrotic lipid depositions. These white, they are the lipids, and this pink, they are nothing but the necrotic areas. So this is the lipid accumulation with the necrotic core, and this is the layer of smooth muscle and tunica adventitia. Now what is this? It's a lipid accumulation in the tunica intima, atherosclerosis, hematoxylin and eosin staining. Accumulation is lipid, organ is aorta, color is a white. Find and determine different layers. I showed you different layers: tunica intima, media, adventitia. Lipid accumulation, here is a lipid accumulation, and lumen, this one is the lumen. Go for the next image. So this one is again very important. This is a cardiac muscles or cardiac myocyte which is branched. These are the nuclei, these are the striations, and this is the fat. This one is not an accumulation, rather this one is a normal. These smooth muscles, they have a nuclei, and in this image, and here only, here as well, if you see the just near the nucleus there are some brown depositions. These yellow brown depositions, they are the lipid accumulation. But why lipid is staining here? Because these lipids, they are not only the lipid accumulate, they also react with the iron. Because of that, they are giving such brown color. And these lipids are dystrophic, or we can say damaged, or by different sort of free radical mechanisms. That's why they are called as the free radical injury. Because of free radical injury, there is a deposition and destruction of the lipid molecules. Then they start to accumulate. So this is what the lipid accumulation into the heart, that is called as the lipofuscin or brown atrophy of the heart, because they leads to atrophy of the skeletal cardiac muscles. Because with the aging, our cell metabolism become decreased. There is accumulation of the free radicals that cause damage to lipids, carbohydrates, and other things. So they are also called as free radical injury. They are also called as wearing and tearing pigmentation, because they are related to the age. Now, this is the lipid accumulation in the cardiac muscles called lipofuscin, brown atrophy of the heart. The staining is He staining, and the lipofuscin on H staining appears yellow-brown. The organ is heart, and deposition is a lipid. It's also called as wear and tear pigment. Show the nucleus. These are the nucleus, and lipid deposition just near the nucleus. So they are the pre-nuclear deposits. The perinuclear deposits, age, and free radical. These three are associated with lipofuscin. And if you try to see on the gross, we can find on the gross image of the heart. If I try to make heart, for example, this is the heart, and if I try to make normal and abnormal, so this one is the deposition of the lipid, normal, deposition of lipid, normal one, deposition of lipid, normal one. Normal will be, I think, slightly reddish because of the skeletal cardiac muscle, and the lipid one will be the yellow color. So it seems like a skin of a tiger. That's why it's called as the tiger effect of heart. So tiger effect, free radical mechanism, or the free radical injury, age related, and perinuclear. So these are all associated or related with the lipofuscin. Two other stains that you must need to remember is, number first is oil red O staining and Sudan black B. These two are used for lipid, and in case of oil red O, the lipids accumulation, it appears like red in color. So these red, they are the lipid accumulation in the liver, and the staining is oil red O. The second one is the Sudan black B. In Sudan black B, you can find these are the lipid droplets inside the cell. So lipids on Sudan black B appears black. So H and E staining, lipids white, lipofuscin yellow brown. Oil red O staining, lipids red, and Sudan black B staining, lipids black. So this was about the lipid accumulation. The next topic of discussion will be the extracellular accumulation, and soon I'll make a video on that. Thank you so much.